At some hospitals, there's a division between parents and their new babies, with very little contact and almost no encouragement for breastfeeding. But a new line is rapidly being drawn. The Texas 10-Step Star Achiever program is helping facilities move in a different direction, bringing mothers and babies back together with a proven step-by-step gold standard method for encouraging breastfeeding, achieving higher satisfaction rates, and earning the kind of recognition that sets hospitals apart.
The baby-friendly designation has been very positive. Our patients are more educated regarding the breastfeeding experience. Their confidence level is higher, and we are seeing higher patient satisfaction scores. The staff's level of knowledge with baby-friendly has increased tremendously. It gives them a better feeling to walk into their patient's room and be able to assist her with breastfeeding and know that they're doing the right thing. The Joint Commission is now looking at exclusive breastfeeding rates. And with our baby-friendly designation, I feel that we're just a step ahead of what the Joint Commission is going to require.
A growing body of evidence points to breastfeeding as critical to health outcomes of mothers and babies, as well as the families and communities they live in. Recent studies show that if the majority of U.S. women would breastfeed exclusively for the first 6 months, it could save up to $13 billion per year.
I don't think I would have had the success in breastfeeding my children if I had not had the support of a breastfeeding-friendly hospital. Breastfeeding my children was a very emotional decision for me. I knew that I was doing the exact thing that they needed, the best thing for them, to nourish them and to help them thrive and develop properly. I take pride in knowing that when I look at my children develop or I see the scale showing that they've gained weight, that I did that I helped them, that I did the best thing I could for my baby.
And patient satisfaction is only the beginning.
I do believe that the quality of care has improved because now, since we practice rooming in, everything is done in the room. Moms come up with their babies in their arms, including the C-section babies too. Our babies are breastfed within the hour after birth. It's just the whole point of mom and baby being together. From the time the baby is born till the time they leave the hospital, mom and baby are never separated.
Space at hospitals is a premium. Being able to reposition the nursery is a real advantage for hospitals and the families too.
Physicians have understood for years why breastfeeding is important, and we're learning that patients are understanding that more these days as well, and they're coming in asking for hospitals that support breastfeeding without reservation. So we have seen that. We have seen those patients coming in and asking for services and asking to be supported in that way, and it's really important to be able to provide that for them. For a physician who is looking to support breastfeeding, it is much easier to do that in a hospital system that is set up to support that patient and baby and mom from beginning to end at the hospital. Having an entire system of care that makes it easier is really important because it can fall anywhere along the way.
10 Steps to Successful Breastfeeding is endorsed by the TMA, THA, and AAP. The number of Texas hospitals working to become baby-friendly is rapidly increasing. It's time to get on board or get left behind.
The initial thoughts when hospitals talk about moving to baby-friendly is that it's going to be more expensive. It's really different. I mean, the difficulty is for the concept and the understanding and the change of practice. The cost did not turn out to be a barrier at all.
Star Achiever walks hospitals step by step into the future to ensure their success and the success of their patients. Texas 10-Step Star Achiever can help your facility stay on the cutting edge, stay competitive, and achieve recognition that will put you on the map.